Those of you who don't know me, my name's Lakeman. I've lived on the island for over 30 years. My two sons were born on the island, went to Castle Rushen. On the 1st of December 2014, they were found dead in a pub in Bolton. They'd taken an overdose of MDMA. They both found dead 2 days in fact after they checked into this particular room. To say I was shocked is an understatement. I knew that one of them had been dabbling in drugs for some time, and we'd had various conversations, like many of you would have done. My view prior to that was that this doesn't happen to families like mine. It does. From the moment that had happened, I was trying to find out what had happened, what could we do. I don't want any family to be in the same predicament as I am, to suffer the things that we have done ever since. And when we came to the inquest about 6 months after the boys had died, one of the things that came out during the inquest was the notion of recreational use. They knew that there was a recreational dose for MDMA. Everybody was talking about it, the coroner, the pathologist, the police, the clerk of the court. They knew that MDMA could be taken safely, and they knew exactly what the dose was. So it was a shock to me that I went to realise that their deaths were totally and utterly preventable if we only took the brave step of saying people are going to take drugs. How do we stop this happening? Because one thing that became clear very, very obviously and very quickly was that our laws, while well intentioned that we should stop the import, stop the supply, doesn't work. And also there is a demand for these drugs. And there will continue to be a demand for these drugs. And we're not going to stop it by sentencing people, having deterrent punishments and things like that. It doesn't work. And the more I looked into it, the more I found out about it, the more obvious it was that it wasn't working and that we need to come up with something else. And my sole interest in this is to stop other families being in the same position that happened to me. And so I came across Anyone's Child. I've been involved with Anyone's Child since 2015, I think. Speaking at events everywhere across the country, proposing similar sort of things. That what people don't seem to understand is we don't want a free-for-all for drugs. When we're talking about we want them regulated and things, we're talking about really tight regulation. We don't need a free market for drugs. We don't need anybody to get their drugs all over. We've already got that. That is what you get now with the prohibition we've got. If you want any sort of drugs, you'll find a dealer prepared to give it to you. But it's unregulated, it's dangerous. It doesn't stop people wanting it. And whether I like it, whether the government likes it, we're not going to stop that demand. So while the demand exists, there's going to be a supply. How do you keep the people safe? We all want everybody to be safe. We do it in every other aspect of our lives. There's health and safety issues, regulation in everything. The one thing we don't do it with is drugs. We just say, don't do it, otherwise we're going to penalise you. You're going to be criminalised. It doesn't work. It'd be lovely if it worked. There'd be no drugs. But there will be a demand, there is a demand. What do we do about it? We have to be pragmatic about it. We have to face what's happening. This has not worked for 50 years. What else can we do? We can't continue going down the same road as we have been the last 50 years, saying it's going to get better if we get tougher on it. Because it's already been proven not to work. So what we're interested in, or what I'm interested in, is same as the government is, same as everybody is. How do we protect our young people? How do we protect our communities? What is the best way to do it But I think that begins with accepting what we're doing at the moment isn't working, and we need another approach. And that's where I come from. You know, I don't want other families to be like me. I don't want people to think that I'm pro-drugs, because I'm not pro-drugs. I have no reason to be pro-drugs. Drugs killed my sons. But all the messages, everything I told them, all the messages they got from school, all the messages they got that these things are dangerous, didn't stop them getting their hands on drugs, didn't stop them from taking a substance that was dangerous to them. Drugs are dangerous. They're dangerous because they are illegal, but they are more dangerous than they need to be because they are illegal. So by making them illegal, we're putting our children into danger. We've also led to the situation we've got now with the county lines, where more and more young people are being involved in the distribution and sale of drugs, being dragged into it. And this is, you know, something that the drug gangs know they can exploit, and they're not going to stop exploiting it because they know people are still going to want to take drugs. We know there's always going to be a market. We need to take the power away from the gangsters, take them away from criminals, and eventually we're going to need to understand that the best way of doing this is regulating the market, so that if people who want to use drugs can get them from a safe place. And then we can start educating people about it. Because while it is banned, it is very hard to educate people. You know, you tell people that they can't do something like this, that there is an immediate attraction. You try telling the kids, 18-year-old kids in schools, if you go into schools, not to do something, and these drugs are dangerous, and not to do it, the only way, they'll turn around and say, well, their friends have taken them and they're fun. They enjoy taking drugs. One of the things I had to come to terms with, which I always found very difficult, is that the reasons my boys went through a lot of trouble to get hold of their drugs. They bought it on the dark web. They thought it was a good way of doing it. They thought it was a safer way not to waste than buying it from the dealer on the street corner. They went through a lot of trouble to get this because they wanted the effects, they enjoyed the effect of these drugs. That wasn't how I brought them up. That wasn't what I taught them. That wasn't what they're being taught at school. It doesn't alter the fact that we have to accept that whether we like it or not, this is a widespread, you know, cultural thing. People do want to take drugs. People enjoy taking drugs. We can't stop it. We can't stop the trade. How do we keep them safe? The only way I can see of doing that is by doing something very, very, what we might be considered radical, but as I think Jane and I discussed this on many occasions, it's actually the same approach that we use to so many other things. We regulate it, we talk and educate. We don't turn around and don't do it, we'll punish you if you do this. So I think that is the way that we should be looking at it. We're trying to get governments to look at it, and the public to look at it, because public education is, you know, very, very important if we're going to change it.